Welcome to the Porecast. I'm your host, Carly Harmson. As a licensed master esthetician with nearly 2 decades of experience, I feel confident to meet you here every week to educate about the latest trends and must-have skin treatments, as well as to decode the science and demystify the overwhelming world of skincare. Whether you're a wide-eyed, curious beginner or you're a veteran skincare pro, this is the podcast for you. So grab your favorite face mask and come discover with me someone who's not only a skincare guru, but also a card-carrying member of Skincare Obsessed, just like you. Get ready for this episode of the Porecast, starting now. Welcome back to this week's episode of the Porecast. So glad you're here. If you didn't catch my earlier episode, towards the beginning of the launch of this podcast, the episode called The Dirty Secret of Clean Beauty, I invite you to go back and give it a listen and hear my commentary and factual information on kind of controversial subject in the industry, the concept of clean beauty. I've heard from some of you, and I've heard a few of you felt like I didn't clearly share my stance on that issue. And you're absolutely right. I intentionally don't share my specific ideologies here when it comes to my approach to skincare because I want to be an objective source of information for you. And honestly, you'd think my personal take is boring. So, my purpose for this podcast is to deliver the facts to the best of my ability, according to my understanding, and allow you the opportunity to come to your own conclusion, whether you're just someone that's looking for your own skincare and putting together your own routine, or you're a professional that offers skincare in a treatment room and puts regimens together for customers. And while I certainly have preferences and methods to my madness, I'm not here to tell you that you should subscribe to my way of thinking. No, 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 no. There's already too much of that in our world. Just extreme black and white thinking that polarizes people, the shock and awe content, clickbaiting. Yeah, it's not me and it's not the way that I like to deliver education. So I hope you will continue with me as I explore, in many ways, another part of this story or the other swing of the pendulum, if you will, and that is the concept of medical grade skincare. In this episode, we will debunk, that's right, debunk the term medical grade. Also, we'll define other important industry terms. We'll clarify what the pillars of this category of skincare are and if they actually make a difference. And we will talk about some of my issues, and they're not just mine, many share these feelings with me, on the use and overuse of this term and why we should collectively abandon and look for alternative ways to promote our favorite skincare products and brands. Diabolical, I know. And just so you know, I come from a history of working with many of these brands that live in the container known as medical grade, and I love most of them and still use their products. I have perpetuated over my career this claim of medical grade early as I was working exclusively with these brands. And as I've been preparing this episode, it had me wondering, where did I catch this term from? Well, in my case, this category of skincare, medical grade, I picked up along the way, likely in the late aughts. What a decade for me, let me tell you. So maybe 2008, 2009. And at that time, I had been licensed as an esthetician for 3 or 4 years. And I was working with an e-commerce brand or store that sold all manners of premium, professional, high-end skincare. So think like derm store, okay? And that role was incredible to land at such an early point in my career. I was a greener esthetician, and this role allowed or afforded me the opportunity to be trained almost weekly on a new brand, their concept or claim to fame, and their product knowledge by their product rep in person. It was a wonderful, wild time, I'll tell you that. And I learned so much. Oh, by the way, shout out to my bestie there, Ashley. Anyway, myself, Ashley, and my other wonderful esthetician colleagues would provide free skincare consultations over the phone and by email. Remember, this was like the late 2000s, so there wasn't like Zoom or video conferencing really at that time. So we would provide these consultations over the phone. So we got very good at asking questions. And then, really, to kind of up level the experience, we might get some really poor quality photos via email. But based on that, we would compose these full professional skincare regimens, pulling from every premium skincare brand you can think of that existed at that time. We had it in our toolbox and we were trained in depth on it. And I'm talking over the course of my time there, probably hundreds of brands. So it was such a fun time in my career, and I really love that job. But looking back, I realized at that time that my only source of continuing education was that from the various brand reps. And this is not different today for a lot of skincare professionals. So I was green, I was influenced, and that is where I first heard the term medical grade. And I took it and ran with it, baby. I was definitely an early adopter of this cult-like mentality. And a few years later, I found myself continuing to promote and advertise those brands with that term when I was an instructor, teaching hundreds of students during my tenure. So talk about a snowball effect. It's 2024 now, and this term is rampant and viral.
All right, y'all. So I know that there's a lot of BS on TikTok and Instagram about what skincare products to use. I'm going to show you guys my favorite skincare products as a licensed esthetician. These are clinical grade products, which means they're not BS products that you can get from Ulta or Sephora. It's the good stuff. Medical grade skincare will always be superior to drugstore skincare products, no matter what anybody says. I never had good skin, and I tried every product on the Target shelves, on the Walmart shelves. In Canada, I would try at Shoppers Drug Mart. If you know, you know. So I would always go to drugstore products. Even the Sephora skincare products are iffy. Once I started trying medical grade skincare products and I invested the money into that, my face, along with some treatments, transformed in less than a year. The best thing I ever did for my skin was investing in good skincare. And not all good skincare that is pharmaceutical grade has to break the bank. A few weeks ago, I was in my friend's wedding and they had a makeup artist out of LA come and do all of our makeup. And we were just talking about what I do and what she does. And she was like, "Do you use medical grade skincare?" And I said, "Yes." And she was like, "I can always tell people that use medical grade skincare and people that don't." I get a lot of compliments on my skin, which I don't take lightly because I used to have really bad skin and now it honestly is really good. So I'm going to show you the ride or die skincare products that I would lay my life down for. I'm going in order of what I use. Okay, first up is this Face Reality Ultra Gentle Cleanser. I started seeing my esthetician Kennedy probably about a year and a half ago, maybe a little bit longer than that. She put me on a lot of the Face Reality products, and honestly, I was a little bit skeptical at first, but everything they have is acne safe, really affordable, non-comedogenic, etc. And I have loved everything that I've tried, minus their vitamin A serum. It really sucks. But anyways, this is the Ultra Gentle Cleanser, and I feel like a lot of people are just using harsh cleansers and then wondering why their skin's like acting a fool. You need a gentle cleanser. Gets my makeup off. Does a phenomenal job. Doesn't smell like anything. Foams up. Does amazing on getting everything really clean, but doesn't strip your skin. You need that, okay? Next up, from literally my own skincare line that's been developed for 2.5 years with dermatologists, also acne safe, non-comedogenic, and clinically tested, medical grade skincare. Fawn Skin Mind Injector Secret Serum. This is a holy grail of holy grail skincare product. Here is my highly requested medical grade skincare routine that literally transformed my skin.
So, in the beauty world, this has just been a term that has been commonly accepted. And I really today want to clarify what it actually means. So, in my research, I wanted to see if and where these brands self proclaim as medical grade in like writing. And what do you know? I could barely find the term. In fact, not a single brand, and I looked at what I think are the top medical grade skincare brands, not a single brand, with the exception of one, had this term published. And the one that did, the term was like buried deep in the website copy. That's right. I went to the top brands that others generally accept as medical grade, and I didn't find that term, not on website copy, not on packaging, and not on social media from the brands themselves. So, what do they claim exactly? Well, you'll have to wait just a little bit later to find out what types of terms they use. What are the main talking points of those that advocate for a medical grade and medical grade only skincare? First, you will likely hear something to the effect of higher concentrations of active ingredients. You may also hear more science and more clinical claims, and then you might even hear special delivery systems or formulation that penetrate further than mainstream skincare. And hey, these are not all necessarily wrong, but they also maybe aren't what you might think too. Is it possible that some of these brands overall use a higher concentration of active ingredients? Yes, that could be in part why the cost is more expensive than even premium skincare at like department stores or Sephora or even in your esthetician's treatment room. But do we know exact formulations with percentage of these ingredients in med grade skincare? Mostly no. And for me, it's not enough of a distinction to like proudly shout from the rooftops. Why? Well, because if you take, for example, an iconic and cult favorite med grade skin serum, I would say this is probably has the most impressions and hits online over any other product. And I'll tell you, it's one that smells like hot dog water. Okay. You'll clearly see on the website and the packaging that it has 15% L-ascorbic acid, 1% vitamin E, and a half a percent of ferulic acid. It's this combination, by the way, that makes up their special patent. But we won't talk about that today. Those are the advertised and highlighted active or key ingredients. This particular serum retails at $182 for a 1 ounce bottle. Now, what if I told you that another brand has almost exactly the same percentages? Just like a slight difference because of that patent. So exact same percentages of actives in that same size, a 1 ounce bottle for $69, and another for the same size bottle for $26.95. The latter two can be purchased anywhere without buying from a med spa, an esthetician working for a doctor, or a dermatologist. And you might be saying to me, well, Carly, it might be a different grade or quality of ingredients, and that's the difference in availability and pricing, even though the actives are the same. And I'd say you're not wrong. But we also don't know that these are higher quality ingredients because there's no regulated or standardized labeling or disclosure to indicate quality of ingredients. Now, as far as the science claims go, I would absolutely agree that yes, these massive brands, most of which have been acquired by what I'll call big beauty conglomerates like L'Oreal and Estee Lauder, as well as pharmaceutical companies. So, yeah, big pharma too. Brands like Allergan and Galderma. And then even some have been purchased by like huge investment firms like Blackstone. So I would agree that these brands tend to conduct a lot more science in research and development, as well as when they bring new products into market. In fact, a couple of the OG medical grade skincare brands began based on groundbreaking science from old white men, which is hilarious, and later became patented and then flagship products of these massive brands. So, yeah, the foundation and legacy is very much rooted in science. And I'm a fan of science, so let's not get this twisted. These brands do have a lot of money power, and a lot of them have easy resources to conduct ongoing science, especially those brands in the pharma families. So, is that to say that smaller indie or family owned brands can't compare or bring great high quality products to market because they can't conduct as much science or they can't gather as many before and afters or clinical claims? And my next question is, do we really want a few megaliths of beauty brands to be the end all be all? To me, the answer is clear. Of course not. Like, that would snuff innovation and creativity. And a lot of our capitalistic society is based on small business. And these brands are not small business. But that's another story for another day. So while clinical claims can qualify claimed results, truly it's not necessary or even highly valuable for a lot of end consumers. Like, they just want to know if it works. And anecdotal evidence from a really confident trained esthetician oftentimes is enough. They want to know it works. They don't always need to see the clinical results, although there are a few of those savvy consumers that do appreciate those. I feel like these clinical claims tend to be more for us skin nerds. We love to see them because it gives us the confidence to make the recommendations. I will also say, yeah, showing a clinically controlled before and after photo to a potential customer of a $200 serum may help to get that serum out the door. It may validate that purchase. That I'm not going to say it's not. So I'm not saying there's no value in these clinical claims. I actually love to read and view the clinical results and claims and studies, but your average end consumer probably isn't going to care too much about that. Okay, now to speak to special delivery systems. It's true that skincare technologies like encapsulation, using lipids, for example, might penetrate the skin a little deeper, and it also is probably a more costly ingredient, hence, could be a reason med grade skincare is a little more expensive. Those delivery systems are not intended to deliver beyond the epidermis. So I have heard some kind of crazy claims like this. At a molecular level, the epidermis is pretty vast. It can be, on average 25 layers deep. But skincare is really not meant to go beyond that. If it were, then we would start to cross the line into what the FDA would consider a drug. And so there's a very careful line that manufacturers are dancing with when it comes to not only formulation but how they're marketing, to make sure that we're not falling into that category of drugs, because there's a whole other level of regulation and requirements and testing that's required for that in the case of pharmaceuticals. So delivery systems are important, as is complete formulation, including pH, stabilization, and more. But this is known to cosmetic chemists formulating for mainstream brands as well as medical grade brands. So again, for me, it's not enough of a distinction. So what is it? What are medical grade products truly offering? In my opinion, we've already established that yes, they do offer more science. The other claims that we went through, I'm not sure about those. Aside from that, I think it's a slight form of gatekeeping. Or perhaps another way to say it is that medical grade brands choose to be dispensed by physicians to help with distribution costs. These med spas, these plastic surgery offices, dermatology clinics, they tend to have a lot more capital to work with when they invest into brands than your solo esthetician. And it might just make sense for their brand to operate in that way. And that's their prerogative. And by the way, if you weren't aware, in order for a skincare pro to sell and recommend most of these brands, they must have a medical director or provider on board. I find this interesting though, because these brands will sell B2C, direct to consumer, without like a medical exam, analysis, or appointment. And many of them also sell on marketplaces like Amazon, again, without like a high level responsibility of a medical provider. Sure, they have them in house, but you don't have to talk to them to order from Amazon. So if I have any serious critique of these brands beyond the medical grade labeling, which I think is deceptive marketing perpetuated by their brand reps, again, the brands themselves don't have it in print, then it would be this. Why push out the people who are most passionate and educated on your brands? Why oust them? Do you think it's the plastic surgeon who sells one of these brands at his practice that is sitting down and doing a full consult skin analysis and then putting together a full home care routine? Hell no. It's not him. It's not her. It is likely going to be a skincare professional, a licensed esthetician. In the very, very, very unlikely chance an executive of one of these brands is listening to this podcast episode, please reconsider distributing to skincare pros in addition to medical providers. Okay? Do a girl a favor, sheesh. And I will say there are a couple that seem to co-sign this term medical grade to describe their brands that do. So shout out to them. They know who they are, and I appreciate that. I'm a fan of that. Okay, another reason is that I do believe that these products are high quality and that they do work very, very well. I think in part they work well besides being well formulated because they are delivered in these environments of med spa, plastic surgery office, dermatology clinic. They are delivered more prescriptively, if that makes sense. So what do I mean? I mean, if you've got an esthetician working in a med spa, for example, who is providing advanced laser modalities, that their client or patient might be investing a few hundred to a few $1,000s on this one treatment. When her esthetician suggests, or in some cases, good estheticians require certain home care, then she's definitely going to just purchase and comply. And it comes from a level of authority that estheticians working in the spa, the day spa, or in their own studio don't necessarily deliver. Additionally, I will say, like, clinically focused estheticians just tend to be better at crafting treatment plans, which may include in-office treatment with the accompanying home care. So spa estheticians, solo estheticians, studio estheticians, really, we could do a better job of that, of not just saying, what do you need, but actually starting from point A to point Z of skincare goals. What is it going to take to get there? And that's going to be definitely an advanced home care routine. All right, I digress. Many of these brands do have accompanying professional treatments, again, which is going to set the skin up for great success when products are taken home. You might remember one of those TikTok sound bites. A gal said that in a year, her skin has transformed between her medical grade skincare. Oh, and treatments. So this is another reason I think that medical grade skincare is going to provide results beyond being great formulated products, being prescriptively recommended, is that they integrate with the in-office, in-clinic, in-studio treatments. And in fact, one big medical grade skincare brand has a term for this. It's called integrated skincare. I think a combination of these things really do make a lot of the medical grade skincare products and brands amazing, and maybe even superior to some other, drugstore brands or department store prestige brands. But we want to be really clear about what it is that makes it that way. And the term medical grade isn't enough. Anyone can self-identify as medical grade. I could put together a coconut oil product with, I don't know, rose hip and lavender extract, and I could just brand and market that as medical grade if I wanted to. Sure, there might be some expectations of clinical claims or like ingredient technologies, but there's nothing that would be keeping me from marketing that way. So we just want to get very clear on what this term or what brands are trying to convey by accepting this term used by their brand reps and their fans and the people that work with the products. All right. Well, let's move on from that. So what about pharmaceutical grade? You maybe heard this term used as an alternative to medical grade skincare, but this term is often misused among estheticians and aesthetic providers too. To be clear, and I'm going to use actual definitions from the FDA here. So I'm going to read. Pharmaceutical grade would be defined as any active, inactive drug, biologic, reagent, etc., manufactured under good manufacturing practices, which is approved, conditionally approved, or indexed by the Food and Drug Administration, aka the FDA, or for which his chemical purity standard has been written or established. Pharmaceutical grade is not used in skincare, but it's often touted as being so. When in fact, active pharmaceutical ingredient, I'm going to quote again here, means any substance that is intended for incorporation into a finished drug product and is intended to furnish pharmacological activity or other direct effect in the diagnosis, cure, mitigation, treatment, or prevention of disease, or to affect the structure of any function of the body. So these are drugs. Furthermore, FDA defines cosmetics as articles intended to be rubbed, poured, sprinkled, sprayed on, introduced into, or otherwise applied to the human body for cleansing, beautifying, promoting attractiveness, or altering the appearance. End quote. So most skincare falls into this category with like a very few exceptions. And so again, it's important that we are all clear on these differences and distinctions. As far as what is actually a drug and used for those things I mentioned, skin health, to treat disorders or diseases, some may be over the counter and some may be prescription. So some examples of over-the-counter pharmaceutical skincare would be hydrocortisone 1%, differin adapalene 0.1% gel, and up until the last few years, a 2% hydroquinone. Today, a prescription treatment for skin disease or to improve skin health might include Retin-A, aka tretinoin, Finacea. I don't know if I'm pronouncing these trade names correctly, so bear with me. Finacea and Skinnerin, which are both azelaic acid, pharmaceutical azelaic acid compounds, and Episerum. These require prescription from a licensed physician or provider, and these are classified as FDA cleared pharmaceuticals. Okay? Now, remember I told you I'd share what these brands are claiming officially in lieu of medical grade, because we really couldn't find that in much of the content or copy. So now's the time I'm going to tell you. Some brands may use the term cosmeceuticals. That's cute, but not regulated. Clinical or clinically tested. It is clever marketing and it's not required. Scientific skincare, physician endorsed, physician dispensed, advanced skincare. These almost chat GPT sounding word combos, they may mean something about the brand, and we've covered what those things are, but just keep in mind they are all unregulated terms. So proceed with that knowledge and maybe with some caution. Don't give in to the marketing machine, okay? All right, let's recap, shall we? Simply, there is definitely many amazing products from medical grade skincare companies, but the term itself is marketing bullshit. I'm just going to call it what it is. This misinformation has been spread by the aesthetics community that largely got our ongoing education from companies selling products. Whoops, I was definitely a player in that. Medical grade skincare and other mainstream products on the market are both considered cosmetics. So there's no difference in regulation, in potency, or active ingredients, or required clinical trials. Medical grade lines likely do have more scientific research and therefore clinical claims and studies to share. So if this fills up your nerdy little heart, then enjoy it, go for it, look for it, consume it. That's great. Just to be clear, as we wrap up this episode today, I am not here to poo-poo on these brands. I am here to educate and hopefully bring clarity to some of these misrepresentations that have been made over the years. So please continue to use and promote these brands. There are some phenomenal products amongst them, some that I love and use myself. But for the love of God, just don't call it medical grade. Yours truly, Carly. So I'm sure a lot of you have something to say. So shoot me a DM and tell me all about it. And I'll see you next week, friends. Thanks for tuning into the podcast. If you liked this episode, be sure to share it with a bestie or on your socials. And if you love the episode, please leave a review wherever you get your podcasts. Your positive feedback means so much to me. You can connect with me at The Real Besthetician on Instagram or The Besthetician anywhere else. And hey babe, this week's podcast looks like clear with a chance of glow. See you next time.